We have a very special guest on the program today. Joining us from DataPath is Charles Robbins, Director of Sales. Hey, Charles.
Hey, guys. How you doing?
We're doing fantastic, and good to have you on the program today. You know, we've got Charles on the program. Yeah, good to have you. We've got Charles on the program today because we're going to talk a little bit about his dad, John J. Robbins Sr., who was a very dear friend of mine and one of the leaders in the consumer-driven healthcare space, and who we really named our leading award of superstars after John J. Robbins Sr. Memorial Leadership Award to carry on his legacy and his name forward, because John. And that award represents, and Chet Burrell, the CEO of Care First, is our award winner this year, and I'll talk just a little bit about Chet in a minute, but that award is to symbolize the total person, the person who really is leading this industry, leading their company, but also leading their community and their family, and representing good ethical character. And that was John Robbins Sr. And so really pleased to have Charles on the program today. Charles, tell us a little bit about what you guys are doing, carrying on your dad's legacy there.
Yes, sir, and I appreciate that introduction, and I'm honored, and our family is honored for you to have that award established in his name, and that means a whole lot to us, and we thank you for that.
Yeah, you're welcome, Charles.
DataPath is a technology platform. We focus on consumer-driven health plans such as FSA, HRA, HSA, commuter, COBRA, and premium billing type solutions. So we typically work with companies like third-party administrators, financial institutions, health plans, brokers, and, of course, they're all working with their employer groups and the end consumer. So we try to develop. We have developed a platform that is consumer-centric and is hopefully closing the gap on the education between what we know as an industry leaders and what the consumer understands as far as healthcare is concerned.
You guys are carrying on the legacy of your dad and the as a leading innovator, because you guys are really doing some innovative things there at DataPath, and also building upon some really good relationships that your dad had established across the market space, right?
That's right. Yes, sir. We're seeing a lot of opportunity. We've gone a couple different directions. The legacy, as you put it, has lived on. I'm one of six, and my brother John Robbins Jr. is the president and CEO of the company, and took over after my dad passed a few years ago. And our company has really blossomed and developed since then. And we've crossed over into other industries, and the delivery of healthcare is a primary focus, in making the delivery of healthcare more efficient and easier to understand for the consumer. So, as an example, we've crossed over into the workers' comp industry and offer a provider payment solution. So it's like a virtual payment solution for providers, and also to reimburse workers' comp claimants for indemnity claims, or their indemnity payments, and for their medical expenses. Also, just virtual payments in general is something that we're working on, and we rewrote our platform as well for the consumer-driven healthcare space. To make it so it's on the latest and greatest technology, and makes the delivery and understanding of those plans. We've built in decision support assistance for the consumer, for the administrator, for the broker, to make that whole process much more streamlined and easier to understand, and ultimately reduce the cost of administration, and put more responsibility and accountability in the consumer's hands. So we're big believers in consumer-driven health, and I think that's why our organizations, DataPath and IHC, really are on the same page as far as how we view the market and the direction that it's going.
Yeah, Charles, this is Brent, and appreciate you joining us on the program. I remember a conference call that I had with your father. This was back in 2006, 2007, when we were first starting to get off the ground. And, just from that conversation, I could see he had the vision. He had the vision for consumerism and where he was going to take the business. And I think he was one of those that was seeing the vision before really anybody else and talking consumerism. Then I also, and I'd like, I saw that, from that conference call. But then I also remember conference calls where your father would go out and he would be, having lunch somewhere, and next thing you know, somebody would be hired working for DataPath, and was a great judge of character of who were the people in your community, and brought people on and hired them.
You're right. Yeah, he. Well, I'm completely blessed to have him as a father, and he's truly unique in how he connected with people, and just understanding people was his forte, really. And he was a visionary. He was. I didn't realize this until after he passed, that really he was a forefather of the healthcare delivery system, and changing it, and trying to find ways to really make a difference in this space. It wasn't about ROI for him. It was all about connections and how to make a difference in this space, and then bringing on people and connecting with people in the industry, and as you mentioned, maybe at a restaurant where he found that that person had something special, he could tell just right off the bat, and would offer him a job. And sometimes it worked, sometimes it didn't work out. But he had a special knack for just really seeing the true person for who they were, just right off the bat. So he was certainly special in that way, and he knew how to connect with people in a way that I just can't describe. I still get emails and phone calls from people randomly from 15 years ago, where the individual said, "Hey, I had lunch with your father. I just wanted to let you know that he made a big impact on my life." And this was just one lunch that they had. So he had a way to make an impact, which is unique and very special. And I'm truly blessed to be his son, and really to witness that. And it helps me and my family and in our pursuit to continue to deliver or change the delivery of healthcare, and really make a difference in consumerism, and helping people understand healthcare, which is very obviously very confusing to a typical consumer.
Yeah, Charles, it's your dad not only was at the forefront of and one of the premier thought leaders in this business, but he had another just solid quality that I think many of us need to embrace going forward, and that, it was all about his word. He was a man of his word, and
right.
and a simple handshake would form a relationship that would move forward. And I've told you this, and I'd like my audience to hear it too, because the award is given in his name for a lot of different reasons that we've just talked about. And at the final one, and he was my friend, and he bailed our business out twice, because we were way at the leading edge with the Institute for HealthCare Consumerism, and twice, bringing this business through a tough recession and a tough healthcare law debate and stall, as we've talked about. I was in a corner, and twice your father, he just simply on a handshake between all of us, formed a relationship and a partnership where it worked for him, but he bailed us out and allowed this business to stand where it is now as leader in the space. And I owe him a big part of that credit, and was just so thankful for the friendship more than anything.
Yeah, and I'm honored for you to say that again, and I can't say that enough. But how you guys work together, and where you are now in IHC as an organization. I really see you guys as the most innovative organization in this space. The conferences I attend every year, it's just a think tank for healthcare consumerism. There's the leading edge providers and a lot of very smart people in the room, and all working towards a common goal, and that is to improve that delivery of healthcare, contain cost, and to help out the healthcare industry in general. Healthcare reform, not health insurance reform.
Yep.
So I can't say enough how I think that everything has come full circle, that you guys have done wonderful things in this space and continue to do so. Again, I know that you have your private exchange health reform forum coming up in March.
Yep.
I look forward to being there for that, because that is there's a lot of confusion around exchanges, and there's a lot of different flavors of exchanges, and I think that that's a really good forum for people to come together and really better understand it and what will ultimately shake out in the exchange world. Yeah. And so that I'm looking forward to that, and I'm glad you guys have established that forum.
Thanks, Charles. We're kind of at the end of our segment, and this has been very enjoyable to have you on, and I really appreciate you taking the time. Please say hello to John Robbins Jr. out there and the rest of the family. You guys have a great Thanksgiving, and we will see you very soon.
Likewise, and thank you very much for having me on, and we'll see you two soon.
Okay.
Thank you.
Thanks so much, Charles, and have fun moving your stuff this weekend.
I appreciate that. Yeah, this recent move has been quite an adventure. So
all right.
Well, appreciate it, Brent.
You bet. Have
Talk
a great weekend.
Soon.
All right, sounds great. Have a great weekend. To the rest of our audience, stay tuned for the next segment of HealthCare Consumerism Radio.